Now I will hop over to Promising Practices. So search Promising Practices is where we will head from here. And we'll see here this full database presenting thousands, so like over 2,300 programs, interventions, and policies designed to improve health across a variety of topic areas. This section is maintained by Conduit HPI. However, we do accept submissions of promising practices, and within your site you have a variety of local promising practices, which can be incredibly helpful to see what other folks are doing in your community. So if you would like to submit, you could just click here and it gives you a guideline of the information needed. So if you have an intervention, a program, whether it's community-based, may or may not have evaluation attached to it just yet, or whether or not that's actually feasible, you can submit it. And our lovely research team over here will go through it and then actually rank it within these 3 rankings, which I will show you within our ranking methodology. Just right here, we'll hop over there right quick. So put this ranking on every promising practice that we post within the site, just so you have an idea of what you're looking at and what that actually means. So an evidence-based practice, this has the strongest evaluation behind it, numbers to show that it had an impact. But then the next best step is an effective practice, which we know evidence-based practices sometimes take a while to get published. So this might be, an effective practice may have descriptive observations of the impact, but it might not be, say, published in a journal just yet, or might not actually be en route to that. But it's still something worth sharing, right? But then not the lowest, but maybe the least evaluated is a good idea. So this could be a new innovation, some things related to COVID maybe, or just even those community-based programs that just might not have capacity to do a full evaluation. But we can see that it was something innovative that we wanted to share out, and it's still worth putting out there to share with our partners. So I'll hop right back to just briefly, you have search options along the side. We want to search for promising practices specifically related to diabetes, see what other organizations are doing in Kansas or across the country. I click on local if I want only the ones that show up from Kansas, as we see in the little parentheses. I can choose primary target audience, topic, and then finally the geographic focus. So these topics are all the same that we saw in those groupings of indicators and in our dashboards. So these are also what are pulled in the bottom of that indicator detail page to show you what other folks are doing. But if I click in one of these, we'll just briefly have a look at what all of this information we can actually see. So this is an evidence-based practice, and I believe this is over the course of 5 years, and what they were able to show as of 2018, we can actually see within the results and accomplishments the whole numbers that they reported, but just in a brief chunk here. You'll see the description pulled from the actual report, the brief goal, impact, and like I said, results and accomplishments. So I think that's really valuable though, as this is something from Kansas, you actually have contact information, which you'll have across, if it's available, across all of our promising practices. But you might know this person, or you might be able to get to know them if they're working in a field that's of interest and close to your work. And we see those topics by which it was organized, who is actually putting on, and then links to where it's coming from. And then finally, we see that related content. To make it full circle, we can see back to that data, see what other reports have been put out related to this topic, to this promising practice, or other resources that are available, funding opportunities specifically.